And I'd like to invite Dr. Christian Scherpenzeel to the stage, our next speaker from the Netherlands, from GD Animal Health and Deventer. Will speak on the attitude of Dutch veterinarians towards antimicrobial use in dairy cows.
Thank you very much, and thank you all for being here and sharing thoughts on this issue, the attitudes of Dutch veterinarians towards antibiotic use in dairy cows. Together with my co-workers Inge Sandman-Berends and Theo Lam, working on this project, but of course big thanks to all the participating veterinarians in this study. And I'd like to share it with you on how it works out. Because the dairy industry, we know that we all have to face restrictive and prudent use of antimicrobials. But specifically in the Netherlands, we face, with this new legislative, that preventive use of antimicrobials is not longer allowed. And specifically for the dairy industry, we know that most of the antimicrobials we use in the dairy industry has to do with udder health. And once we have to make a big step in reducing antimicrobials, then the dry cow injector has our main focus. So in the Netherlands, we faced this, and that was the reason that, well, the dry cow antibiotics were only allowed in cows with an intramammary infection. So that meant that we only are able to cure cows and put antimicrobials in those quarters where a proven intramammary infection was going on. So in the Netherlands, selective dry cow therapy became obligatory in 2013, a year before a guideline came to action, which was actually in 2014. But of major importance, and we know that from the work from Jolanda Jansen, Theo Lam, that the mindset and attitude of farmers is very important in the success of such a legislation. But we had our focus also on their veterinarians. And that is what I want to share some thoughts from this issue. Well, where do we come from? Over here you see the years on the x-axis and on the y-axis the compounds of antimicrobials in the Netherlands. And what you see that in the reference year of 2009, we had to reduce our antimicrobials with a large percentage. And you see it diminish and diminish up to a reduction of up to 60% in the year 2015. And that is actually what where we are now. But then the problem is that the legislators say, okay, you're doing a great job, maybe you can reduce up to 70% if you are reducing so quickly and so fast. Well, actually, most of the professionals in the Netherlands say, well, the bottom line, we found out the bottom line, but these data don't lie that we are now having reduced up to 60% reduction in the Netherlands and now facing new issues. So that's where we come from. And then focusing on the veterinary professional, that is of course the subscriber of antimicrobials on the farm. So the advisory role and the main responsibility towards antimicrobial use and prudent use on the farm lies within that veterinarian. So we know from previous studies we've done the uptake and the implementation of selective dry cow therapy on Dutch dairy farms and the consequences for antibiotic use, economics, and for udder health in general are of major importance. But again, how about the mindset of the farmer and the mindset of the veterinarians? And as I said, the guideline, the professional guideline for veterinarians from our Royal Dutch Veterinary Association was launched in 2014. Which said, okay, we use cow-level somatic cell thresholds to select cows for dry cow therapy, being 50,000 cells for multiparous cows and 150,000 cells for heifers. So from that perspective, zooming in on the veterinary professional and its mindset, we were wondering, okay, how do they feel about this? And we knew something already from the attitude of the farmers, but to, well, improve responsible antimicrobial use, we still need to know about the veterinarian. And the objective of this study was to describe the attitude of Dutch bovine practitioners towards antimicrobial use in general and selective dry cow therapy specifically. So we used a retrospective evaluation, asking veterinarians back in time how they felt about the introduction of this new policy, using a questionnaire sent to all Dutch bovine veterinary practitioners by email in March 2015, using SurveyMonkey, with 3 major chapters. What were their thoughts about how their farmers would react on the questions we asked them? What is their attitude regarding antibiotic use in general, and specifically then for the dry cow therapy and selection for dry cow therapy? Within the content, the mindset, some positive and negative aspects of reduction, and the criteria used to select cows, all based on different questions using Likert scales, agree, partially agree, completely agree, and so on. And from that 648 within our sample, 207 questionnaires were available for descriptive analysis, so a response rate of 32%. Well, jumping to results, first part was their thoughts about what their farmers would answer. And that's quite, well, you need to understand that we asked these same questions to a bunch of farmers we published earlier in Dairy Science, but it wasn't published yet when we asked their veterinarians how they would think their farmers would answer the questions. And then it's what you see here. So the percentages you see are the percentages of farmers and vets, respectively, that agreed or partially agreed on the statements you see. And then you see reduction of antibiotics is important. Well, there are some interesting parts in that. Mainly the ones in red now, that the veterinarians thought that the implementation of selective dry cow therapy in 2013 was quite underestimated, where the farmers, well, 75% already implemented it. The other way around, the consequences of antimicrobial reduction, it leads to more disease and culling of cows. Well, 50% thought that it would be that would lead to more severe cases and to death, but only 10% of the farmers reacted this way. And since I started with selective dry cow therapy, the other health status on the farm, what was the big change? Well, the veterinarians overestimated quite more than the farmers did. So that's interesting data on how they react on the implementation of this. So conclusion so far, the Dutch bovine veterinarians predicted that their farmers are more pessimistic about the new policy than they actually were. And for the severity of disease, the vets overestimated the other health problems that their farmers actually perceived. So, good to know this. But the second chapter in our questionnaire was how see vets their own role in the new antimicrobial policy. And the positive answers were, I see myself as the main technical advisor, 71%, and I do play an active and proactive role in the changed policy. That's very positive, but there were some negative messages as well. I'm the messenger of bad news, up to 15% of our sample size, and I'm a solver of problems the farmer needs to handle, up to 9%. And moreover, they said, okay, I'm quite positive about the new policy about selective dry cow therapy. I judge myself as being on the right page with antibiotics, and I'm completely, well, 99% of the veterinarians introduced selective dry cow therapy on their farms themselves. So that's quite positive on this. Well, their attitude towards general antimicrobial reduction. These are those Likert questions I told you about. And then you see over these statements, antibiotic reduction is important. A statement like, I stimulated clients to reduce antimicrobials, and with less antimicrobials, I still can be a good veterinarian. Well, most of the cases, they were very positive-minded. This was interesting to see, the introduction of selective dry cow therapy on their farms within their practice. Well, up to 100% of the farmers within the practice of the veterinarians, the introduction was quite smooth. But when we asked them, okay, did you already evaluate 1 year after the introduction, the introduction of selective dry cow therapy, then actually not every veterinarian did it on all farms. You can discuss, okay, that is a time issue because they need time to evaluate it. But, well, it was a year after the introduction and still not everybody evaluated it that much. Well, we had some statements as well from veterinarians, and, well, I like papers I read where, when you read some more socio-psychological papers, where the statements give the good tone of voice within that papers. And some said, okay, I'm quite positive about antimicrobial reduction policy because it forces me and my farmers to change farm management instead of protecting the cows with a blanket of antimicrobials. And another sound was, I completely agree, but I feel the urgency to reduce antimicrobials, but the way the government maintains and pushes on my daily work in practice demotivates. So that's actually the tone we're in, that everybody is very constructively, farmers and veterinarians working constructively on this policy, but still it needs to go together with, well, with the stick and the carrot. So you need to have a bonus when everything is going right and a malus when not everything is going right. So it's all in these statements found back. So to come to conclusions, the mindset is a crucial part of actual change in the use of antibiotics and specifically dry cow antibiotics as well. Then the mindset of Dutch bovine practitioners seems positive, and vets can improve their advisory skills by asking more questions instead of thinking of the farmer. And finally, the dairy farmers seems to be more adaptable to change than veterinarians in the way that the farmers were, well, more able to find the consequences of this policy on their farms, where the veterinarians need to follow up more. That's it for so far. I would be very happy to take any questions. If you want to discuss more on the subject, then feel free to meet us at stand C22 to discuss further on the subject.
Thank you. Any questions from the floor? Yes, at the back there. If you'd like to come forward to the microphone, please. In the meantime, I have a quick question while you're extracting yourself from the crowd there. I was curious to see the point about the limited evaluation post-implementation of the selective dry cow therapy. Did you get an opportunity to explore the reasons for that any further? And if so, are there any ways to assist vets to evaluate? Is it a case of time? Is it resources or tools? Or are there ways that you can motivate that?
Yeah, very good question, Finola. Well, I think it is a question of time, a matter of time, because what we do in the Netherlands it's legislation as well, that we have to yearly evaluate the animal health status on farms, specifically, animal health in general, but other health specifically as well. The time we asked these questions, it could be quite early, so we should ask them again to find out if the follow-up is better than before. And my empirical and experience in the field is that they come over and do it certainly because they see it as a chance for the veterinary role. Yeah.
Okay, thank you. I'm like a rabbit in headlights, so I can't see where that person is. Fire ahead.
Do you think that doing interviews would have been better than questionnaires for what you were trying to sort of understand, where like farmer attitudes and vet attitudes? And if so, why did you choose a questionnaire over?
Yeah, very good question. Of course, detailed interviews and one-to-one interviews could be much better. It always is a question of time and money expenses on this subject. So I think, with the sample size of we had, I think it was, quite a bunch of people. So it could be, you're completely true, it's better than you do a one-to-one interviews with a large bunch of veterinarians. So to jump to conclusions, I was quite, it seems positive. So to come to significant conclusions, we'd better do that. Yeah. Thank you for the question. Yeah.
Any further questions? Yes, one more there.
In the back.
Well, thank you for the good report. I would like to ask, can the Dutch veterinarian take profit from the sold drugs?
Yeah, good question. We did ask them something about how their business was doing, and then not only their business model on sales of pharmaceuticals and then sales on antimicrobials, but as well on could they make a profit of their advisory work that came from all this. And the change we see now is that farmers more and more focus on their farm management, and that the advisory role of their veterinarians is getting better and better. And that change of their business model to a more advisory role is taken up, well, very great to my opinion, because you discuss more and more on animal health subjects on the farm. And, well, it's not in our data here, but the other health states in the Netherlands is never been better for now, yeah.
Okay. Thank you. If there are any other questions, I'm sure Dr. Scherpenzeel will be happy to take them at the stand. Oh, can't remember the number.
My pleasure, yeah.